Good afternoon, everyone. My name is Yanela Barrios, and today I'll be summarizing the key points that were discussed on our second week forum, aging demographics and trends. From the discussion of our second week forum, aging demographics and trends, we can conclude that there is a direct relation between position in the slippery slope of aging and chronic conditions. We, as PT, can hugely impact this slippery slope of aging with our ability to reduce acquisitions of some chronic conditions, or at least reduce the impact chronic conditions may have on patients. The best way we can prevent our older adults to suffer from chronic conditions is by targeting the young adults. This way we could prevent those chronic conditions before they ever happen. And this eventually will take us to the position in where older adults are more independent and more functional. And study found that physical therapies were perceived to be best utilized to address a specific problem or after a fall instead of being utilized for preventive care. PTs need to encourage our population to stay active and educate them on the benefits of movement and also the disbenefits of sedentary living. It is important to mention that even passive activities can have benefits on our older adults' health. Some of the benefits include improved quality of life, emotional well-being, physiological status, physical and functional abilities, and social relations. Another study concluded that the elderly population is projected to increase in all states, but that most of the geriatric population are relocating to the rural areas of California, Texas, and Florida. This will represent an increase in the need of PTs on those areas. Another important point that was discussed on this forum was the fact that not only PTs but mostly of the healthcare providers tend to categorize patients based on the group they belong to. This can cause stereotypes such as ageism, and an example of this would be that predicting a patient that fits a certain mold of age and sex will act the same way, therefore they should receive the same treatment. It has been proven that stereotyping among healthcare providers can negatively affect the quality and quantity of care of the older generation. In fact, a study concluded that nurses who use cognitive behavior therapy techniques found significant improvement in relieving nurses' ageism through older adults. This takes us to the conclusion that we can improve the health and well-being of elder individuals just by the reduction of ageism. To conclude, I would like to say that the opportunities for PTs to promote the health and function of older adults are broad, from the elimination of stereotypes, the promotion of preventive medicine and exercise, inclusion in social activities, and interdisciplinary work with other healthcare workers. However, all of this must be executed simultaneously and not independently.